agree that everyone deserves equal health care, no matter the background, no matter the circumstance. So what we're going to talk about today is just that. We haven't met everyone up here, so I want you guys to take a moment to introduce yourself, where you're from, what your backgrounds are, etc.
Hi, my name is Marisa McGinley. I'm one of the neurologists at the Mellon Center. I'm from Ohio originally. I'm from the Toledo area, and I did my school all in Ohio, except for in Chicago briefly for residency, and then came to the Cleveland Clinic for fellowship, and then I have been happily on staff taking care of patients in Cleveland.
Hi there, I'm Kelsey Poisson. I'm a pediatric neuroimmunologist at Nationwide Children's Hospital in Columbus, Ohio. I did my training at Cincinnati Children's and then went all the way down to Birmingham, Alabama for my fellowship in adult and pediatric neuroimmunology, and then joined the team here at Nationwide Children's.
Hi again, my name is Marion Jones. I am an NMO patient diagnosed in November of 2020. I don't have the impressive medical background, official medical background history as those on the panel, but I did run my first marathon in November.
That's an accomplishment. You guys have heard from me a few times, but Justin Abbatemarco, I also work at the Cleveland Clinic Mellon Center.
So the fact that it's kind of hard for those with diverse backgrounds to navigate the healthcare system as our patient, please tell us something that you may have experienced, a disparity or something that you had to overcome.
Yeah, so I will say that, you know, having lived with NMO for the past 4 years, you know, there's a lot of things that, you know, as a patient, once you're officially diagnosed, you start to think about symptoms that you actually experienced before the actual diagnosis happened. And so for me, that was my case. I was living and doing some work in Tennessee, and I had actually started to experience excruciating back pain. This was going on for several weeks, and usually I'm one to try and self-medicate, but it got to the point where I actually had to go and seek medical care. And I just remember the first doctor that I went to see, the first specialist, was very dismissive of, me just coming in and saying that I had back pain. The other quote unquote issue was, at the time I was a consultant, so I didn't have health insurance. And because, at the time I thought, I'm young, and why do I need to be paying health insurance as a consultant? I usually get the health insurance through an employer, but at this time, I was just, out there living the dream and living my best life, doing consulting work for Nike, and I just had never been sick, a day in my life aside from the common cold as a child. And so I just remember that experience with that doctor, and then being just, pushed aside, and then actually going to another doctor, and this doctor happened to be a person of color. And so that experience was a lot different because, I walked into a room with someone who looked like me first, and it was a woman, and I just think that she was more, receptive to really just trying to understand the source of my pain. And actually through that process, she came back to me after looking at some scans, and she said, it's interesting because when I did a few neurological tests on you, she said, I started to lean toward MS, but she said, but it's not MS. And so I'm not sure if she was familiar with NMO at the time, but she said, I think, it may be just you have cysts along your spine, so that could be, a part of the problem. But I actually think at the time I was presenting symptoms, and I just don't think we had actually gotten to the diagnosis yet. And fortunately, a year later, I moved to Boston, Massachusetts. And when I started to have this migraine headache, someone said on the panel that that was their first symptom as well. Earlier they talked about that. And I had a migraine headache that I had for almost 2 months. And one of my friends said, this doesn't seem like something that's normal. So I think you should go to the hospital and get it checked out. And so we went to the ER, and just through that experience and that ER visit eventually led to my diagnosis within a matter of 72 hours.
Okay, so, and thank you for that. For the patients, the physicians, how important is it for you to learn the patient's background? When you're meeting someone new or someone that's been with you for a while, do you like for them to tell you their stories? Is it important for you to use that to identify any disparities and obstacles that they may be facing in their recovery and your treatment plan?
Thank you. Your story is so important, and I think sharing these stories is really what needs to happen, because we as clinicians and physicians need to hear our patients. And so I think something that we all can learn to do better is listen to our patients and their backgrounds, and I think that is the most important thing. There's an old adage that, if you listen to the patient long enough, they'll tell you what's wrong with them. And, it's a simple saying, but I think really powerful, is that we need to listen. And we don't always do that well. And so I think that can be a problem for many, many groups. And I think that there are obviously certain populations that are disproportionately affected by that. And I think we need to acknowledge that, and we need to listen to our patients. We also need to understand where you're coming from, just your life story. So we're thinking about these symptoms at the time, but how have you interfaced with the medical system? What's your support structure? What other things could be barriers to how you're presenting your story? And so that is absolutely as important as the general medical things. My vision's a problem, I'm numb here. The rest of the story and how it's affecting your life and where you're coming from, I think is incredibly powerful, important about how we get to a diagnosis sooner, because as much as we'd love to say your story was unique, it's not. I would say that the majority of my patients come in and they have some sort of aspect of feeling not listened to, not heard, presenting many times. It's never a good feeling to diagnose someone with any chronic condition, especially an NMO or a MOG. But I'm always so grateful when we can do it early, and we can get people on treatment, which is incredibly important. So we don't want stories like yours where it takes a lot of time. And I think as a community, we need to hear more about this, and we need to be better at listening to our patients.
I think that was so wonderfully said, and I'll just echo that sentiment of listening to your patients. From the pediatric side of things, right, the average age of onset for NMOSD is 8 to 10 years old. And so when we think about MS, we think about teenage years, but for NMOSD, that can be even younger. And so listening to our patients, it means listening to our younger patients, but also to parents. And I have, unfortunately, so many similar stories, and it's actually the reason I went into this field, is because I've had at least 2 stories of Black African-American female teenagers who weren't listened to. And thinking about the racial disparities and the implicit biases that providers can have during these numerous encounters in the healthcare system that patients take to get to their diagnosis can be hard to hear, but we need to hear that so we can make changes and make progress. And so I'm working on sharing some of these stories and also research in terms of what are the root causes of these delays to diagnosis. And I think something that's really relevant in terms of listening to the patient is go in with fresh and open eyes, right? Because so many of these stories are these 2 patients, for example, that I now take care of, where they went in and you've been vomiting for several months, you have hiccups. Well, it's an eating disorder. Okay, you have a psychiatric diagnosis. Now you can't walk, it's psychiatric, right? And so these 2 teenagers, one almost couldn't breathe by the point where she had to go to the ICU and get a breathing tube by the time someone realized and had a neurologist come and check her reflexes and check her exam to realize that something very serious was wrong. And so these are the stories that are, they give us the chills, right? But they're the reasons why we push forward and we try to do the best we can to listen and to not just say, oh, someone else made this diagnosis, let's go along with that. No, fresh and open eyes and new perspective is really important.
Marion, thank you so much for sharing. Yeah, not unique in the health field, as we can hear. And you guys already hit on so many great points. Maybe I'll take it a different angle. I've talked to a few patients even outside of the talk. We've talked about advocacy and advocating for yourself. It's always okay to go ask for another opinion, go meet with another medical team. No one should ever make you feel that's wrong or anyone's going to take offense to that. I hear patients sometimes mention that I don't want to hurt someone's feelings or things like that. You have to advocate and find that right team member for you. And sometimes it takes a little bit of time to find those right team members. And then I agree, on the medical side, right, we have so much more work to do creating awareness among our providers and others so that we don't have these stories anymore. And we're working towards it. And these kind of talks are really important.
Is there any tips that you give a patient after you heard their story? Is there anything that you can tell them to how to navigate the healthcare system? And that goes to you as well, Marion. Whoever would like to answer.
All right, sure. So I guess for me, the tips I would, share with any patient, echoing what was just said is, don't take no for an answer. When you know that there's something going on with your body, that there's something that you feel that's different, or even if you're going into a facility and the medical team members, you don't feel comfortable. It's not someone that you feel is a trusted advisor, and you're not feeling like you are being heard. You can always go and seek other options. There are, through the social media groups that we have that are geared toward NMO and MOG, there are a number of different individuals that you can, tap into that are in your same area that may be able to refer a different, hospital or something to go in to seek a second or third opinion. And so I think that's critically important, that that at the moment that you're diagnosed, you then become an advocate for yourself. And, the thing that you do at that point onward is, read as much as you can, research as much as you can, talk to as many people as you can. And I think that's why a community like the Samira Foundation is so important, because you can really just go into a space where a number of different patients have already done some of that leg work, and they can help you and help guide you and be a support system as you're trying to get to that right doctor or that right neurologist or that right hospital.
Yeah, I think those are great points. One thing that I always tell my patients to do is tell me what you don't understand about my explanation. If I say this is a good treatment for you, this is not a good treatment for you, you deserve an explanation of why we're doing something or not doing something. And if I'm not providing that to you, that's a problem. So I think that having that really bidirectional communication between a healthcare provider and a patient is really important. And I think that helps us, not make these mistakes, right? When it's very dogmatic of this is what we're doing, and you don't warrant an explanation of why we're doing that or not doing it, that's a problem. That attitude's a problem. And so I think as a patient, again, advocating, but really pushing back for a reason why things are happening. Many times then if a patient says, well, why didn't we try this? And I will say, oh yeah, that's a good, it's a good question, and when I'm pushed to give an explanation, it makes me be more thoughtful about things. And so patients just asking questions, I think, is really, really important, and they should feel empowered to do that. And again, not just take the whatever we say as the answer without an explanation.
I think it's a partnership, right? That's what you're describing, and it's awesome. Yeah.
Yes, what you just said is very powerful. To invite the patient to be part of the treatment plan is so important. They don't want to be talked at and told them, hey, this is what we're going to do. And if they feel uncomfortable to advocate at that time, they may not tell you, hey, I don't want to do that. So now they're going into this treatment plan feeling overwhelmed the fact that they're there and overwhelmed at the fact that they're doing something is they're not comfortable with. I remember a time when I first was diagnosed, I was in the hospital, and here comes the plasmapheresis machine. And I'm like, wait, what is that? I don't want to do this. Like, nobody told me this was going to happen. The person wheeling it in said, oh, well, this is ordered for you. You're going to get this. And I just said, go ahead and push that back on out. I'm not going to do it because I wasn't comfortable. And so it's very important. I really like what you said. My next question is, along that line, is what are your thoughts about connectivity within the health system to assist for faster diagnosis, comprehensive care? Are there opportunities that you see can be, what do you do, and what opportunities are there for improvement?
I think it's all about communication, right? I mean, we've always said this is that we don't communicate well enough with each other, with our patients. It's a problem. And I think we also sometimes are, just as patients need to feel okay with second opinions, right? We as clinicians need to also feel okay and should communicate with each other to put our heads together, right, about patients that are complex. And so there obviously needs to be more communications between healthcare systems. There needs to be more mechanisms to provide those second opinions. I think we need to rethink how we deliver healthcare for patients. Right now it's very much, if a patient can get to you, great, then they get the care they need. But if they have barriers to getting to you, they can't get the care you need. And so there needs to be ways that we can communicate and patients can get care irrespective of who they are and where they are. And so I think that's an area of growth. And I think there is better ways to communicate in our electronic medical record. There's more sharing of information, right? But there needs to be more networks of ways to provide consults and ways to get patients, high quality care, especially for rare diseases like this that need specialist input.
Yeah, and I'll kind of piggyback on that, access to a specialized neuroimmunologist is, in a big city is a given, right? But in a lot of areas of the country or the world, it is not. And that kind of gets amplified for my patient population in pediatrics because there are so few pediatric neuroimmunologists that a lot of my patients are traveling a few hours to see me. And that's not easy. And so I think that working through creative ways to meet the patient, the family where they're at, and to know what those barriers are is so important. Some of the work that I've done shows that the further you live from a pediatric neuroimmunologist can be associated with worse outcomes in terms of your disease. And so we need to do better in terms of educating, general pediatric neurologists, general neurologists, but also figuring out more creative solutions to, I need to meet this family where they're at. They cannot drive here. They do not have transportation to drive to clinic. What can we do to advocate for telehealth in a system where after the pandemic is over, insurances are pushing back on us? And so there are a lot of things that we feel like our hands are tied and we have to keep advocating to improve.
And you just touched on what I was going to touch on, which was just technology and telehealth and being able to use that as a resource for people who don't have that sort of care directly in their zip code.
I'll touch on what our panel talked about before, this multidisciplinary care. I think obviously clinicians are a piece to the puzzle, but not the whole puzzle. Our rehabilitation experts, mental health experts, patient advocacy organizations, making sure that's all kind of talked about, maybe not at the first visit, not the second visit, but trying to get those resources together in one spot, virtual, however we are able to have patients access that in a space that's meaningful to them is so important.
I know there are certain times where I would go to the doctor and they'll be like, oh, I see that you saw Dr. XYZ you talked about. I'm like, well, great. I don't have to sit here and try to tell you everything that I have understood. But there's also times where you go and you'll tell them, hey, I was diagnosed with this, or I'm taking this. And they'll say, well, when did that happen? Or, XYZ. And you just feel so disconnected. You feel as though no, you're not being heard, your treatment plan is not complete. So that's definitely something that we want to prevent. And I know you guys are making strides towards that. We have about 3 more minutes in our session. If you guys have any questions out in the audience, we'll take that at this time. None. Do you guys have anything else to add? Any of the panel? Anything else?
So maybe it's a question to all the doctors on the panel. We've seen interest in health equity wax and wane. People were focused on it for a while. Then there was a little bit of a backlash, I would sense. So could you just tell us from the system, a health system perspective, what are your systems still doing on this? Is it still a priority item? And what sorts of things are you trying to do to address health inequities?
Well, I'll start and say that partnering with groups like the Sumaira Foundation, as I'm part of their Health Equity Coalition, in terms of moving forward. And I think that a lot of the adult MS literature has really delved into this, right? And it's now bringing this into the more rare disease space. And it seems difficult that we have to kind of prove these things, right? To say, like, look, there are these inequities. And I think there's less resistance to at least talking about these topics because they're not easy to talk about, right? They're uncomfortable. And so I think that there's at least more of an awareness. And then I think it's more about bringing this into the rare disease space, which is more difficult because we don't have as many patients, right? And the pediatric side is even harder. There's no research currently published on health disparities in pediatric neuroimmunology. And so that's a big focus of mine, is first looking back into the past in terms of these patients with NMOSD, and we've identified health disparities in terms of race, in terms of distance to a center, and in terms of your insurance or the language you speak. And so my focus is really bringing this into the pediatric space and identifying the root causes that can happen in the family setting, right? Because a child I'm seeing isn't just the patient. This happens not in a vacuum. This happens everywhere. This happens in the community. This happens at home, with friends, with school. And so I think that really the next steps are not just identifying, but also taking steps to intervene. And so that is how, for example, at Nationwide Children's Hospital, this is being done in other areas, right? So can we bring these interventions from other areas into this space? And so, for example, for pediatric asthma, there's healthy housing programs where hospitals are directly funding programs to provide families that are living in, houses with mold or that are unsafe for children with asthma, healthy housing. What are some ways that we can directly partner with the community to better assist patients who need transportation or who need better education about their diagnosis so that we can do the best care that we can?
That's our time. No, no, that's perfect. I want to thank everyone for coming to speak on the panel. You guys are great, and I'll hand it over to, I think, Sumaira. Yep.